Good afternoon, everyone. This is Bill Keegan, Town Manager in Foxboro, with your COVID-19 update. Happy to be with you again. Unfortunately, we wanted to just share with you some challenging news that we are continuing to trend in the wrong direction with our infection rate here in Foxboro. We're currently up to 95 cases. Only one hospitalization, which is good news, but certainly want to wish the very best to that individual who is hospitalized. But there is hope along the way, and I want to talk a little bit about that this afternoon, because we have a news from the governor's office this afternoon that we do see that the vaccinations are starting to. They have a plan now for the distribution of vaccines. He did do an extensive press conference this afternoon, and I'm happy to provide you with some of the information on that. So it looks like that the governor's program will hopefully be acted on this month, and that it's the information that I received today was that if it happens this month, and we're waiting for just the final go ahead from the FDA, that the program has that the vaccination program has been approved. That once we have that information, then we can go move forward, and the distribution of the vaccine will begin. All right, so how does this work? In terms of order of priority, if all goes as planned, we will see vaccinations starting in December in Massachusetts. And the way that will work is it will be done in a phase 3 rollout of how the vaccines will be administered. In order of priority, the first will be clinical and non-clinical healthcare workers doing direct and COVID-facing care, long-term care facilities, rest homes, and assisted care facilities, police, fire, and emergency medical services, congregate care settings, including shelters and shelters and corrections. Home-based healthcare workers will be given the vaccination right away, and healthcare workers doing non-COVID-facing healthcare. That's in phase 1, and that's expected to occur during the months of December, January, and into February. Now, if all goes as planned and everything stays as anticipated at this point, phase 2 will begin, and that will occur in February of 2021. And in order of priority, individuals with 2+ comorbidities, high risk for COVID, or otherwise known as high risk for COVID-19 complications, those individuals will be vaccinated next. Early education, K through 12, transit, grocery store workers, food and agricultural workers, sanitation workers, public works workers, and public health workers will be vaccinated next. And adults over 65 and older will then have access to the vaccination. Individuals with one comorbidity will also be given priority in terms of the vaccination at that time. And at that phase, the first phase is about 300,000 doses of vaccine will be made available. In phase 2, we expect 1.9 million to be available, and then phase 3 will then be available for all the general public at that point in time. So phase 3 is expected to begin sometime in April of 2021. So that means until typically probably between April and June. Most people that want the vaccination will be able to get it during that period of time, and then of course it'll be available as an ongoing basis from there on in. This is it's a 2-dose type of vaccination. The first dose takes place, and then 6 weeks later another dose is given. And so obviously it takes a little bit of a time frame for people to get the vaccination, and then to become and then during the period of time when they become healthy and no longer become subject to receiving or getting the COVID-19 COVID disease at that point in time. So I think what's important here is that we keep this in mind, that the vaccines will not be distributed in Massachusetts until the FDA determines the vaccine is safe. Vaccines go through more testing than any other pharmaceuticals, including extensive testing and clinical trials. The FDA and the CDC's Advisory Committee on the Immunization Practices, ACIP, ensure any vaccine is both safe and effective. and infectious disease leads in Massachusetts academic medical centers plan to review the EUA data and provide an independent opinion about their safety and efficacy. And COVID-19 vaccination provider agreement requires reporting moderate and severe adverse events to the vaccine adverse event reporting system. So far, what has been made public and has been distributed through the press is that there are some side effects, and that the side effects are more commonly seen in the second dose as opposed to the first dose. So we will all see this as it rolls out over the course of the next 6 months or so, and we want to see that and that's going to be kept closely. It's going to be under the close watchful eye of the CDC as well as the FDA to make sure that the program is working as planned. Of course, in the middle of this, or the very beginning of this, of course, there was going to be a change in administration for the U.S. government, but having said that, there is a lot of agreement about how this plan will work. I'm sure there'll be some levels of disagreement on certain aspects of it, but generally speaking, what I've just laid out to you is what's going to happen, at least in Massachusetts, as we understand it at this point. In terms of the equitable distribution of COVID-19 vaccine, that was given quite a bit of consideration by the state administration, by the governor's office, lieutenant governor's office, to make sure that it's being distributed properly. So the advisory group took a strong stance on equity. What they said was what they wanted to make sure that it prioritizes all COVID-facing individuals in healthcare settings, including food service and environmental, not just doctors and nurses, as well as home healthcare workers as well. 20% of the additional vaccine allocated to communities that have experienced disproportionate COVID burden and high social vulnerability. So clearly, those folks that are most vulnerable were the ones who are going to probably get it the first. It will be able to get it first before anyone else, and certainly we'll continue to track that as it rolls out. Anyone who would like more information on the COVID-19 vaccine plan, facts and more information are available at mass.gov/COVID vaccine, all one word, mass.gov/COVID vaccine, and so again, all one word, and you can get that online as we speak. There's quite an extensive advisory group that's been put in place to oversee and make sure that's happening properly. Dr. Paul Bittinger is the chairman, and he's from Mass General Brigham, and a very, very talented man who's got a lot of information and understanding of how emergency type situations evolve and how they work, and is heading up this advisory group, serving as the chairman. I'm also pleased to report that locally on the Foxboro level, our fire department and health department have been working closely to align our efforts here. Our fire department is prepared to administer vaccinations if we're given the green light, and we will proceed accordingly once we have that information and we have the plan in place. It's good to know too that Chief Kelleher has been asked to serve as a representative of the Mass Fire Chiefs Association, to serve as the advisor on the vaccination process. So we'll be getting any information that happens on the vaccination plan will be coming to us firsthand from what he understands and what information he's been getting directly from the state. So we'll be hearing it probably before most people will be getting it, but as a result, we're in a better position to give you more information on this program as it currently rolls out. So that is the latest information I have for you. Again, I can't emphasize enough how important it is to be very careful about socializing with folks that you haven't seen on a regular basis. Even family members that you haven't seen in quite a long time. You want to be very careful, especially during the holiday months, that you do not socialize with folks that you've not been with on a regular basis. Again, continue to wear your mask, wash your hands 6 feet apart. Those are the standard operating rules here, and so the more we do that, and the more we abide by that, the better it is for us, and we'll all be safer because of it. So that's the latest information I wanted to provide to you today. Again, our case numbers, we're up to 95 cases right now, and we'll continue to keep an eye on it. We do We are still within the yellow phase of the COVID process and rating system. It's at 2.61% in terms of infection rate. So we still are okay in that regard. It's not rising above 3 or climbing in that direction. Cases up are only up by 3 cases since yesterday, so at least it's not pushing up dramatically. But that can change at any time. But we're clearly seeing some of the impacts of what happened during Thanksgiving, and so as we roll into the Christmas holiday season, we want to make sure that everyone continues to act as responsibly as possible, and so we don't continue to impact those numbers any further than where they are right now. I'll continue to keep you updated as necessary to provide you with the latest information that we receive here, and hope that you continue to stay safe and healthy, and continue to practice the right protocols during this pandemic. Hope you stay safe, and I'll see you soon. I'll be back with you with more information as soon as we have it. Have a great day.